Hello, I'm Eric from Delos Therapy. This is Gina from A Sweat Life. She will be our model today. We'll be talking about shin splints and what causes them and how to get rid of them. We have a lot of patients in the clinic that come in with shin splints. Typically, they are runners or people that are doing high intensity interval training. All of that's great, but you have to maintain the pliability of the muscle around the shin bone or the tibia. So let's get right into it. Typically, what's happening is the muscles on the front of the shin, they could be on this side or this side of the shin, but what happens is as those muscles get tight, it can exert a force directly on the shin bone. And as those muscles get tight, if they get tight enough, it will cause that bone to eventually splint. You do not want that to happen. That will be excruciating pain. So I see patients that come in and there's sort of a dull ache in here, all the way to you can't even touch it, and then that's when I'm recommending imaging. Right? You don't want it to get that bad. So let's get right into it. Push on the muscle on the inside of the tibia. So this muscle right through here. So these are the inside of your calf muscles, so the soleus, gastrocnemius. You want to do what we call the self-pliability test. So you want the muscles to be very soft and spongy, right? So if they feel hard, that's a problem. As they get harder and harder, what they're doing is they're contracting and they will pull right on that tibia. And it will splint it if it pulls hard enough.
It's a warning.
Right, so the first thing you want to do is just see if they feel tender. So just kind of feel on the inside and the outside of the tibia. See if they feel hard. Once you've figured out the areas that are tender, that feel tight, that's where we really want to do some detailed work. So at that phase, you want to start at the bottom of the muscle. And you can use 2 thumbs, you can use 1 thumb. But the critical part is get right up against the tibia, and you can even curl with your thumb a little bit to get those medial fibers. Exactly. It'll be typically pretty tender, but what we're doing is we're applying pressure and we're forcing that area to stretch. If you're trying to stretch this area of your body, you can imagine that's a very difficult area to stretch. Lengthwise, conventional stretching, which actually won't be effective. Go ahead.
Oh, I was just going to say, so as you can see, I'm sort of digging my thumbs in around that calf, or on the medial side of this, the inside.
Yeah, and try, I notice your thumbs are kind of separated, so really try to keep them together. And what'll happen is it'll focus that pressure into one spot, because if your thumbs are apart, you're actually pressing on 2 different areas. All right, so we want to apply pressure directly into the muscle. It's critical that the thumbs are together, so it focuses the pressure in one spot. So you don't want your thumbs to be apart. That's going to be less controlled, working on multiple areas at once. You want to focus that pressure right into one spot. So start at the bottom of the tibia and just slowly work your way all the way through the top. So holding pressure 2-3 seconds, move to the next spot, hold pressure 2-3 seconds, and generally it will feel pretty tender.
Yeah. I don't think I knew I was this tight in this area.
Most people don't.
This is delightful.
So we do what's called a grid format. So you want to go up the whole muscle, change direction a little bit, go down the whole muscle, back and forth a couple of times. The sensitivity should go down with each pass.
So as I'm moving down this muscle, should I sort of follow the same pattern, or should I be out an inch or so?
I would say go up and down the same line.
Got it.
And then move.
Roger, I'm on it. Thumbs stacked. So this for me is a surprise, because I think I usually know where I'm tight and where there's pressure, but I think that this is one of the oft neglected muscles. For me at least.
As a general rule, if your pain is on the inside of the shin, you can bet that it's the inside muscles that are tight. If the pain is on the outside of the shin, the outside muscles are tight. So that's a general rule that you can follow.
I have very tight calves.
Runners, people that are pretty active on their feet, people that work on their feet for long periods of time, women that wear high heels, these are areas that are just undergoing more wear and tear, and over time they will get tight. So now let's do the outside of the shin. So there's a couple of different ways. I like to sort of grip the whole leg and just come in with my thumbs directly connected and just press right into the top of that muscle. So you should be just outside the tibia and pressing right in.
That's your shin bone, friends.
So don't push into the bone, definitely push into the muscle.
Okay. Yeah, this is definitely less tight.
Yeah, so it should not hurt. That's an important part. It shouldn't hurt too much, meaning the pressure should feel good.
Yeah.
Right? So hurt so good is something that we commonly hear. If the pain is out of proportion and you're barely touching it and it's excruciating, definitely think about getting an image, because at that point you might actually have damage to the tibia.
Ooh.
And if you can't apply enough pressure with your thumbs, then we have a lacrosse ball.
Yeah, let's do it.
So let's show you how to do that. So go down, sit down, and get in a comfortable position. It's really important to be comfortable. Put the lacrosse ball into the area that feels tight.
Oh, this is much tighter than I thought it was.
Yeah, so what we've noticed there was the tightness patterns were a lot deeper than you had access to with your thumb. So you weren't able to apply enough force with your thumbs to actually access the tightness, which is totally fine. So this angle will apply more weight, more force into the tissue and get to the deeper fibers.
Ooh.
Just make sure everything is done with control. So there's no movement with pressure, it's static pressure, one spot at a time. And it's much easier to move the lacrosse ball or the knobble than to move your body.
This you could do watching TV,
Yeah.
living your life.
Yeah, my experience is if you're not comfortable while you're doing it, you won't last long. You shouldn't be aggravating your shoulder, holding your body weight up by working on your leg, and then your shoulder starts to hurt.
I'm guilty of that a lot,
Yeah.
but I'm getting better. This is much comfier.
And then you can tuck your toes under a little bit if you can.
Oh, yeah.
And what that's doing is that's stretching it lengthwise while you're stretching it again with pressure. So you want to go up and down the whole outside, and then you want to do the same thing on the inside.
Honestly, my runner friends, I feel like this is a gift to you from Eric.
This can help you so much, and it can completely get rid of shin splints, and it will help your running. It'll give you more muscle availability, more muscles available to recruit and fire. It'll make your running a lot faster.
Whew, back to the top.
And did you do the inside?
I didn't do the inside. Ooh, let's do it.
The inside. Make sure you do everything completely. You don't want to do just the outside or just the inside. You want to cover both sides of the shin.
Of course, of course. So same setup as before. My knee will be down.
Yep.
I'm just moving. So you can't see it because it's on the inside. Let's
have you rotate around.
rotate around. I'll give you a preview. I'm still in that same position where my feet are down, but now I just can move the ball.
And I would do both sides. If you guys are self-treating at home, try to do both sides. Just because one side hurts and the other side doesn't hurt doesn't mean the other side isn't tight. It just means it's not quite tight enough to cause symptoms.
Even it out. Ooh.
Icing is another important thing. If your shins feel very, very sore, icing can help with some of the inflammation, some of the soreness, but keep in mind that's not doing anything to force that tightness to stretch. It's not changing structure. We have to change structure.
Oh boy.
The first signs of any kind of pain in the shin, definitely get it evaluated. So now we're working through the inside, so make sure you do equal amount of therapy on the outside and the inside. We're really trying to create uniformity around the tibia, and do it for 10 or 15 minutes on each side of the tibia and each leg.
Got it. All right.
And it's important, get up, walk around, see how they feel. Typical feelings, body will feel light. You might have a sense of warmth, sense of looseness, and those are all good signs.
And how frequently should one be doing this shin work for their shin splints?
Yeah, so I would say it depends on how much activity. So if you're training for a marathon and you're doing a lot of high volume training, probably at least a few times a week, if not daily. If you have a history of shin splints and you're starting marathon training, I would get fairly aggressive with it. I mean, I have patients that are doing it 5-10 minutes a couple of times a day. If you have no history of it and everything feels good, I would do it weekly just for maintenance. Something has to be done, but the more volume of training and the more history of shin splints, the more often you have to do it.
Thank you, Eric.
You are welcome. Happy to help.